He had pain in his chest, and then all of a sudden he couldn't walk.
Tonight, on the finale of Save My Life.
The circulation's been closed off, so everything is at risk of dying.
Inside Boston hospitals, as good as it gets when trauma comes knocking.
You're gonna lose them.
The motor vehicle collision.
I've talked to you about this 8 million times. You could have killed not only yourself, but the other 2 people in your car.
Unrestrained driver involved in a rollover.
You got a pretty big cut on your forehead.
Well, don't look at it then.
All these years, I thought he didn't have a brain. Apparently he does.
He doesn't want to ride him.
Hi, team.
We were 6 minute ETA to the rooftop.
We don't know where the bullet is.
Right now, the primary concern is stopping the bleeding and saving his life.
Gas prices across the state are holding steady this week. AAA Northeast reports that regular unleaded is unchanged at $2.33 per gallon for regular. Prices are 5 cents lower than at the same time last month.
Boston Medical Center, we are currently en route to your facility with a 41-year-old male unrestrained driver involved in a rollover. Currently has a large laceration to the top of his head. 2 minutes out.
No questions. Think you see him trauma 2. It's not so good. Whenever a patient has a very bad accident, what we call a significant mechanism, like a rollover, MVC, motor vehicle collision, where they're not wearing their seatbelt, a lot of those patients have really bad head injuries.
17 to trauma 1 patient here.
41-year-old male involved in a single car accident. Face sustained a 8 to 10 inch laceration right above the eyebrow, all the way to the top of the skull.
So lots of stuff's going to be going on, okay? Okay. What happened to you? What do you remember?
I flipped over.
How did you flip over?
I was messing around with the radio navigation on the thing, and next thing you know, the curve came up too quick, and I went off the road.
Okay. Were you wearing your seatbelt?
No, I wasn't.
So you got a pretty big cut on your forehead?
I felt it. There was blood everywhere, so I was like, oh, here we go.
Well, it goes right down to the bone.
Yeah.
Through the skin and the muscle. Yeah. We're going to go see with a CT scan.
Yeah.
We can see what you're thinking.
Yeah, I know, right?
Yeah, what was I thinking?
All right, I'm off to go to CAT scan, okay?
Okay.
All right.
When you see a deep laceration on a forehead like this from blunt trauma, you have to be thinking about bleed in their brain, neck injury, bleed somewhere else in their body.
Pedestrian struck by motor vehicle coming in, unknown injuries.
And what happened?
A car hit me.
That stinks.
Mm-hmm.
Were you crossing the street or what?
I was.
Okay. Did you hit your head? Did you pass
Stop
out?
cutting my clothes off. This all I got left.
Okay.
I'm gonna trust y'all. Don't take my belt.
Ma'am, I'm
No,
talking right-
screw you.
Can I see your fingerprints? Just
Don't
for
touch me like that. Ask me what you want to do before you do it.
Can I listen to your lungs?
Do you want to hand me everything?
They still breathing. They still pumping.
Deep breath. Can I put these stickers on you?
I don't want no stickers.
Looks like you got a bump on your forehead. Does this hurt right here?
You know what? Stop touching me.
Can we get you off this hard board? Is that okay?
All I want to do is get out of here.
All right, here's how it's going to go the fastest. If you let us do our job, then we'll do it. We'll get you off the board. We'll get you out of here as soon as we can. What do you think? It's a little frustrating. You're trying to do the right thing by the patient, and they're swearing at you, calling you names.
This is the first time ever in my life I've been hit by a car.
Sometimes people are a little shooken up, you know, traumatized. I don't think she's really that injured.
So what I'm gonna wear to go home?
We're gonna get your pants.
As long as you get me something to wear, I don't want to wear no
Gown? I don't
hospital pants.
No, we don't have them. Don't worry about it.
But I just want my pants.
Tons of patients come in refusing help, combative, but we usually win them over with our wit and charm.
I'm glad to be leaving here. Just keep your eye out for the cars. Even if you think they're not coming, they're coming. Be careful.
Elmira, call 30371, please. Elmira, call 30371. Thank you.
1, 2, 3.
This guy rolled the car a couple of times, landed on a roof.
You're trying to stay real slow, okay?
Could he have a skull fracture? Could he have an intracranial hemorrhage or a bleed inside of his brain?
Okay, that looks good to me.
Looks like his CT scan is negative, meaning that there's no bleed in his brain, and then he doesn't have a broken neck. So the next thing we have to do is just repair this very large laceration on his forehead that goes down to the bone. How's your pain?
Oh, I'm not really in any pain.
He just doesn't want any pain medicine. He feels fine. And this big cut on his forehead, he says, oh, it doesn't even hurt. So that's pretty unusual.
There's someone here to see you.
Uh-oh.
Hey, honey.
Uh-oh.
Don't you look nice?
Don't I? Well, don't look at it then.
That doesn't hurt?
No, not at all.
What'd they give you?
No, they give me a tetanus shot.
That doesn't count as pain meds. Honey, your head is split wide open. All these years, I thought he didn't have a brain. Apparently he does.
Funny, haha.
I don't know how he's doing this without pain medication. He's handling it well, so I'm proud of him. But I'm gonna kill him when he's better.
It's not a very easy laceration to repair because basically you have lines on your forehead that go sideways, and his laceration went straight up and down on his forehead. And so when you repair it, you have to think about repairing the muscle underneath, because if you don't, then for the rest of his life, he's going to have kind of an abnormal movement of his forehead. Every expression is going to look odd.
You're doing good. When there's an emergency, we've learned that Sean's not the one we call. I delivered twin babies a year ago in the bathroom by myself. Sean showed up after the first one was born, looked at me, saw the baby in my arms, and went pure white. And then he disappeared. And then I delivered the second baby, called 911 myself. They came, and I didn't find out where he was till the next day. He was in the garage. Apparently that's his safe place. No, it looks pretty nasty, but it's gonna heal up really well considering what it looked like when you came in.
This guy is very lucky that despite having a bad accident like that, he really just has a big laceration on his face. Definitely people should be wearing their seatbelt. By and large, what we see here when people don't wear their seatbelts is pretty horrific injuries, so for sure they should.
General Hospital coming in with a transfer patient. 52-year-old male with a dissecting aorta. BP is 174/64 and ETA is 4 minutes.
He had a little twinge of pain in his chest and his back, and then all of a sudden he couldn't walk. And they found that he had a dissection of his aorta all the way down to his leg. If he says build, then he'll need to get that artery opened up again, or else he'll lose the leg.
All right, my friend, we need to put a special kind of IV into your artery because we need to monitor your blood pressure really closely. The higher your blood pressure is, the worse this could get. We want to bring it down pretty quick.
Whatever you gotta do.
That's the attitude I like.
Right.
An aortic dissection is a tear in the blood vessel that supplies blood to the entire body. Do you have a history of high blood pressure?
Yes.
Do you take medicine for that?
No.
How come?
I'm an ass. And, you know, every time I went in there, it's like, oh, yeah, you're still borderline. It's like, well, if I'm taking it, why isn't it working?
That's a conversation for another day.
Yeah.
We have other things to deal with today.
He sat on the couch and felt a pinch or something. Went to stand up and his right leg was just gone. Gone. He was perfectly fine last night.
What we're doing right now is we're trying to see if we can find a pulse in your foot. I don't expect we're going to find one because we know that you've clotted off that artery there. But this one's definitely warmer.
Yeah.
That's just the lack of blood flow getting in there. All right, let's go look at his scan.
I just hope they get the feeling to the leg back.
I'm speechless. I just can't believe it. I mean, he's only 53.
And, you know, the worst case scenario is that he actually ruptures the dissection, and then he'll just bleed to death.
female, fall 25 feet with a compound leg fracture. You're going to Boston Medical Center. Med 4, we up.
Sounds like a 20-something-year-old female fell off a climbing wall. She's got a fracture of one of her legs.
Apparently she's about 25 feet up in the air, free climbing, slipped off the wall, landing on her left ankle.
You take a couple of deep breaths for me? Good. Sorry to fell off a rock climbing wall. Are you winning?
Yes.
Oh, good.
In my own mind.
Okay.
Right in the last round, she went for her last route and ended up taking a fall really hard.
I got up to the last part, about 25 feet up. Fell and missed the pad that you're supposed to land on.
You didn't hit your head or anything? No.
There's an open fracture dislocation. So we're going to take an x-ray and get a better evaluation of it.
X-ray?
It looks like it's just dislocated, the bones aren't broken. So that's good. Once he puts it back in place, he's going to feel much better once he moves it back where it belongs, okay?
We're just going to let your leg try to hang right off the bed, okay? You're going to bend your knee there. Just let it hang, okay? Just let it dangle. Okay, you're just going to feel just a little bit of pulling, okay? You're almost there,
Just
okay?
gotta try to relax your leg as much as you can.
You're doing a good job. You're doing a good job. Deep breath, okay, Kelly? Deep breath. It's all done. You're back in, Kelly. Good job.
We're done?
Yep.
You just gotta put a cast on, okay?
Okay. Does it feel better? Yeah.
Yeah, it usually always feels much better when you get it back into the right
So we
position.
weren't lied to. No.
So, it was a pretty high fall. She's lucky it's only that injury. It's pretty serious. So. I think climbing might be out for a little bit.
Once I get better, I'm gonna be back on the wall.
When she gets better, she owes me a beer because I just got served a beer right when I got the news. But she's worth a beer.
So we have a patient with a torn aorta. We're about to look at the scans to see just how bad it is.
See that there? That's the aorta. See that line that goes across it?
So the scan shows that he's dissected his aorta, the type B dissection, but it's an extensive type B dissection to the point where it goes all the way down into his leg, so he's not getting any blood into that at all.
There's some clot sitting right where the aorta deviates into the leg arteries.
If we don't restore blood flow to his lower extremities pretty quickly, then he could lose his legs. But if his aorta ruptures, then he'll bleed out and he'll die.
Can you feel me touch you at all? You can't feel any of that?
Not really.
Okay.
So we've involved the vascular surgeons, and the plan is going to be to take him to the OR as soon as we can.
There is a chance, an outside chance, that you'd lose this leg. It's been at least, about 5 or 6 hours. We're going to get you to the OR as fast as we can and just relieve the swelling. And then we'll work on the blood clot. All right, we'll take good care of you, okay?
It doesn't sound good. My biggest concern is I'm gonna lose him. My second biggest concern is he's gonna lose his leg. Still don't feel nothing.
I haven't had a feeling in 5 hours. It's pretty bad. They don't have to amputate.
T2A11, respond to the stabbing. 1 male stab.
Big fight going on. Supposedly one person's already stabbed. The police just arrived on scene. It sounds like he must be stabbed pretty bad because they're asking for a push on us to expedite.
He said he had a black Red Sox cap.
Being really dark. Those dark spots, you know this flag, not Phoenix, right? Flag.
31-year-old male, good stab. The laceration to the left side of his face, right around the ear. Got a deep wound to his left lower quadrant. Any questions?
No questions. Seeing trauma too.
How you doing? All right?
I've never been stabbed before, so
Yeah.
sorry, I ain't telling nothing but what's coming.
So a stab wound to the abdomen can be bad. Any sort of penetrating wound in this area can certainly be lethal. These patients can deteriorate quickly.
He was in an altercation. Man pulled out a knife. You didn't see how big it was, but he got stabbed. He got a slash mark to the left side of the face, one to the left thumb, and also one in the left lower quadrant. It's about 2 inches wide. It looks pretty deep. He says now he's starting to get some cramping. What's going on?
He's got a stab wound, 3 centimeters, left lower quadrant. Any pain where I'm touching?
Oh, it's just that side.
Just right here?
Oh.
It looks like he went through the fascia. Little pain right here.
Sensitivity of CAT scan?
We're gonna do some scans, okay? Take a picture of your belly, see what's going on.
It's a stab wound. The question is, did it go into the abdominal cavity or not? If it did, you may need an operation.
I came home from my family, and I walked in my house, and somebody just started swinging a knife. Truthfully, I don't even know who it was.
We're just gonna check the blood flow.
The thing that we're worried about is colon injury from the stab wound. They have a good contrast in the bloodstream and in the rectum to light up the colon.
You want to stick a tube into your rectum?
What? My ass?
Yep.
For what?
See if there's any perf into your bowels. So if that leaks into your stomach, you're gonna have a real problem.
Your heart rate went up to about 120 when he said that.
So let me relax. It hurts when I laugh.
So you best call
I'm looking for any injury to the solid organs or any free fluid. So that's muscle, and you see that sliver of air in there. So for him, we didn't see anything.
The preliminary read was normal, no intra-abdominal injury, so close but no cigar. Looks like he got lucky.
I don't even know why this happened. That's the worst part. So I'm still breathing, so that's the best thing. I feel lucky because you know why I'm still talking, like I said, right now. And I know that kid's still got a father right now.
2 people provide a television ED X-ray, please.
We just called in the vascular surgeon to examine my patient with a torn aorta. It's a life-threatening condition, so he'll likely need emergency surgery.
Essentially what's happened is the aorta is the main tube that comes out of the top of the heart, gives off branches to the arms, the head, the neck, to the intestines, the kidney, the liver, the gallbladder. In your case, the lining of that tube has ripped or torn, and blood has gotten into the wall of that blood vessel. And it's partially closing off the circulation, potentially to the intestines, to the kidneys, to the legs, even to the spinal cord. So the concern is if we don't do anything, everything I've talked about is at risk of dying. Okay.
Sick guy coming through. Look out.
He calls me the Weeping Winnie, you know. Because like he's so calm and so easygoing, and everything just rolls off his back. Are you cold?
No.
If you get cold, let us know, okay?
All right.
All right.
Our anesthesia doctors are very quickly going to put in a small drain around the spinal cord and drain the cerebrospinal fluid. The reason is when we cover that and repair that aorta, there's an increased risk of paralysis. And right here, you can see linear tear where the dissection starts. And then it travels all the way down through the chest, down through the abdomen, and even down into the legs. Okay, and then we'll take very good care of you. In order to be able to treat this, we choose stents or grafts that are going to be introduced through a small incision in the groin through the femoral artery. To be honest with you, he could live without a leg. The life-threatening component is it's also compromising the blood supply to his intestines, his liver, his kidneys, his spinal cord, and those are the things that would likely kill him.
I told him not to leave me. We've been together almost 30 years.
We have 2 kids. And I don't know what I'll do. I don't know what I'll do.
Stab victim. Good 2 stab wounds deep to the left chest wall and deep laceration across the chin.
No questions. Procedure after 2 acute on your arrival by Charlotte.
Believes he was stabbed with like a pocket knife. He's already bled through 1 trauma dressing.
Hi there, I'm Dr. Anderson. This is going to be a little bit busy as we get you settled in here, okay? So airway is intact. There's a laceration in the left upper quadrant. There's 2 in the left flank. Stab wounds, they're pretty unpredictable. The left upper quadrant, if that had been deeper, that could either involve the heart or the diaphragm or the intestines. So it's Russian roulette. You are one lucky guy.
Yeah, I'm so sorry. What a sucky night.
Yeah, I know.
Where did this happen?
Right in front of my door. He just came up behind me and slammed my head and started stabbing me and then gave me a phone.
Did you get your phone?
Just need a little stitch in there.
How bad does my chin look?
I'm not gonna lie, it doesn't look great right now. But it's only gonna look better from here on out.
Okay.
Here.
I'm very calm about this whole thing.
You're the calmest I've never seen anything like this I've ever seen.
I usually meditate every night.
He's a really atypical trauma patient. When he's not intoxicated or high, he couldn't be nicer. He was super calm. He actually was minding his own business. I'm gonna clean up your chin while she's doing that. Is that okay? Yeah, this is gonna heal really well. Do the police know about this? Yeah.
When I first seen him when it happened, it was like a nightmare. You open up this shirt, there's blood everywhere, but, you know, he defended himself.
Did you see it in the mirror at home?
No.
One more. And then we'll be done. Okay. Looks good. Do you have a phone here? You could do a little selfie.
I want to say it's in my right pocket.
I see some cigarettes in here, which you're gonna quit, right?
Yeah, these don't want.
Throw the cigarettes away? Nice. Okay, lighter's going out. Can you see?
Close that knife.
Yeah. Okie doke. He let me throw out his cigarettes and his lighter and promised to quit smoking starting today.
You're a real strong, real brave man, seriously. Chicks are gonna dig your new scar.
Zahn Blanchard, please call 6797.
Let the family know we're getting started so that they're not worried. Thank you. Okay, let's go, gentlemen. Light handles are okay, yes? All right, we're going to start with a knife to me, please.
This is your husband's ring.
Oh, thank you.
Okay?
Okay. Thanks.
You give medicine, sometimes the fingers swell up, so we don't want it to cut off the circulation.
Okay. Thank you.
Yep.
Okay, we ready? All right, another big vein here, huh? Got sort of a web of veins here, huh? All right, fine, tie. Watch your pressure. So this is the initial piece. This is that stent graft that's going to go up from the incision in the left groin, and then we're going to bring this up right to the top of the aortic arch. Then we come down, come down, come down. Force up. Thank you. Keep that pressure up, gentlemen.
We're coming to you with a 22-year-old male was injured in a motor vehicle collision. Question of internal injuries will have more on arrival.
A 22-year-old
was involved in a high-speed motor vehicle collision.
Airbag deployment, major damage to the vehicle. He was unconscious on scene, and he was given 4 mgs of Narcan.
He was the driver.
He was the driver.
Okay.
He was given a medication, Narcan, that if you've taken narcotics should help improve your mental status, and he woke right up.
I have blood all over my face.
Just a little bit, not that much. He's got some dry blood on his hand, but I'm not actually seeing a laceration.
Hello, sir. I'm Dr. Harrison, supervising doctor. Been any medical problems you're aware of? Meds or allergies or?
No.
The good news is you didn't kill anybody that we're aware of yet.
No, seriously, everyone's all right-ish.
To the best of my knowledge, and I said you didn't kill anybody. I didn't say that they're all right.
I know, but that's what scares me the most. I feel so bad for the other people.
He's got vital signs that are reassuring. His initial evaluation is reassuring.
Do your favor, just turn your head a little bit down. Good, just like that.
He doesn't have any blood in his head where it shouldn't be. His neck's okay. The obvious concerns are his, what we call his social history, so that he's using substances and he's going out and hopping behind the wheel of a 4,000-pound death machine.
Can you tell me what happened tonight?
I haven't relapsed in a long time. And my buddy called me trying to get a ride. I switched lanes and I slammed on the brakes as hard as I could and I hit this car in front of me, and that's really all I remember.
I've talked to you about this 8 million times, and you could have killed not only yourself, but the other 2 people in your car. Is this somewhat of a wake-up call? Do you mean it?
I do mean it. I do.
You're very lucky.
No, I'm a guardian angel.
Don't keep testing it, because everything has its limits. Did Mom yell at you, or am I the only one who's yelled at you?
Pretty much just you.
It's okay. Am I gonna kill you if I hug you?
No.
He's got quite the guardian angel. He's made his share of mistakes that hopefully he's learning from.
We'll just keep you for like another hour or so. Your heart rate has come down, which is great.
The heartening thing was that he recognized the seriousness of this, and that's always the first step. Until somebody wants to change, none of us can do anything.
Don't do drugs. It's not worth it at all. You're gonna hurt people, you're gonna hurt yourself, you're gonna hurt your family and everyone you love. It's not worth it.
So let's peel this off, flush out the back. So we rebuilt the top of this aorta, okay. There's already a better pulse in here. Fantastic. That looks pretty good.
Almost 3 hours, and we haven't heard anything. Waiting is the hardest, that's what they say.
Okay. Still need to do a fasciotomy for this right calf. You gotta get underneath that part there. We've put in 2 stents to reestablish blood flow to the legs. Now we're going to do some incisions on the lower leg to relieve pressure and tension and prevent long-term damage. And that's not nearly as bad. I think that's actually very good here. And the good thing is we can see the muscle is still alive. I can feel the pulse. Try it. Yeah, baby. That's what you want to see. So that's much, 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 much better. Outstanding. Success, gentlemen. Thank you, ladies. Good job. So we've gotten him through the acute part. He's got pulses in his feet. His kidneys are working. The perfusion to his spinal cord seems fine. His right leg's coming back. So he looks fantastic, guys. He really does.
Okay.
Heart's working, brain is working, lungs are working, kidneys are working, blood supply to the intestine, blood supply to the legs. And even the fact that we opened up the muscle and the muscle itself was alive, it wasn't dead, that's huge. So far,
Okay.
we're right there.
Yep.
And it's fantastic, and so we'll take it.
I can't thank you enough.
It's okay. Now you have the ICU. Now we want to keep an eye on his blood pressure. Now we have to make sure there's no other potential complications, and that's why for the next 48 to 72 hours it'll be critical.
I'm so thrilled that he made it through surgery. And I'm just going to go with what the doctor said and just take it as it comes. And at the moment, he said everything looks good. And I'm going to keep telling myself that.
This woman was actually in the parking lot when two of our doctors noticed that she seemed to be having a stroke.
Ma'am, can you squeeze my fingers here? Squeeze, real tight.
You know, didn't immediately say, oh, she's having a stroke. Two people were there in scrubs, and they said, you know, is she okay? Can we help? And I said, yeah, she's having some sort of an incident.
Lift your leg. Keep it up there.
I'm Dr. Lou.
Oh.
Okay, I know there's a lot going on. We're
Yeah.
concerned that she's having a stroke, okay? But she's in the right place, all right?
Oh, no.
We're gonna get some scans and get some stroke experts here, okay?
Can you look over here?
Look over here at me. Excellent. Very good.
Look over here towards me.
The question in these cases is always, when was the person last seen well? And that can be really hard to establish. In this case, she was lucky she was in the parking lot. She was seen by someone who recognized the signs of stroke.
How many fingers am I holding up?
These kind of strokes are caused by a clot somewhere. These clots, when they go into the brain, they prevent oxygen from getting to the tissues.
Keep your leg up. Keep it up.
Keep that leg up. Keep it up there. Up, 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 up. Hold this leg up. Hold it up. Hold it up.
So we need to scan the vessels in her brain to determine where exactly the clot is. Really hoping she's a candidate for life-changing medication called TPA.
So actually, if you guys are okay, unless you're ready to scan her this second, we'd like to just give her the bolus.
Go ahead, you guys.
Okay.
I'll do it.
TPA thins the blood dramatically, very quickly.
Now, don't move your head any, honey. They're going to be giving you some medication here.
The faster that these kind of medicines can be administered to the right patient, ideally the better the outcome.
What time was it?
6:19, I had you giving it.
Excellent.
That's a good time, right? We'll keep watching over the next day, see how much improvement we get. We may see some early. It may take some time. We still think people benefit even 3 to 6 months out from the TPA. And so she'll probably be with us in the hospital for a few days.
Loud and clear, go ahead.
About 3 minutes out, it's a 19-year-old male shot twice, once in the left pelvis, once in the right thigh.
Trauma 2 on arrival. So, it looks like a 19-year-old that's been shot to the left pelvis. Pelvic injuries scares a lot of trauma surgeons. It's a bad area to be struck in. What hurts, buddy?
My legs.
Your leg.
I can't feel my legs.
Which leg, buddy? Both of them? All right.
Can you wiggle your toes for me?
No.
Single wound.
Are you having...
We'll take care of you, all right? Let's get some pain meds and everything and make sure everything's fine. Airway's intact?
I can't feel my legs.
So he had one wound in front of his left hip and one wound kind of around his thigh. Who knows what the circumstances are about what actually happened, but 19.
You know if it was a male, female?
It was a male, black, right here, all black, everything.
Did he say something before you got shot?
Uh-uh.
Okay.
This is so scary.
And he had the gun to my face, and the gun just kept going click, click, click.
And we were walking, and next thing I know, I heard 4 gunshots go off.
Are you having any belly pain at all?
Oh, right there, right there.
Pressure's up. Let's get him some fentanyl.
So the main concern that we had when we did a bedside ultrasound is we couldn't actually visualize a bladder at all. So those make us really concerned that he's got a bladder injury right now.
He's my world. At 18 and 19 years old, been through everything together.
Zahn Blanchett, please call 6797.
Our stroke patient is already doing much better. The neurology team responded in record time.
You look much better than we last saw each other.
She got the TPA to help break up the clot, and it did. So the vessel opened up again, she got blood flow back, and she looks a lot better now. Give me a squeeze. Squeeze my hand. Squeeze. Okay, good. Show me your thumb. Okay. Can you say the word cat? Okay, that's fine. Give me a big smile. So, she's getting much better. Speech is still a problem.
When will you know that she's out of the woods, so to speak?
It's going to take some time.
Okay.
So, we're going to watch her very closely overnight. I think the IV medication works.
Okay.
Okay? All right. You just relax for now, okay? All right. This drug has changed neurology. When she first came in, she was unable to really communicate with us at all, unable to move her right side. Now, after the TPA, still trouble speaking, but full strength and improving with speech.
Of the, because, Mars, my God.
I don't understand, honey. Like I said, you had a stroke, you had a blood clot, okay? And right now, it's affecting your speech, your ability to talk.
You know, of the,
It's okay, just take it easy, okay?
Yes, you're going to stay in the intensive care unit where they're going to watch you very closely, okay? You've been through a lot. These things are going to take time. All right? Well, it just must be so hard to see a loved one like that. But we're really glad that her husband, who's so loving, is by her side.
Trauma team, talk to.
Where hurts it the most?
Just from there, low.
Down here, down?
Yeah.
Okay.
Oh.
Don't look at it, man. Okay, get that chest under the casket, all right? We know he has a pelvic injury. Now we're trying to see if he has a bladder injury, and then we'll determine whether he needs operative management or not. So the bullet is there.
Yeah.
Where's that? The bullet is... Okay, so this is the deal now. The bullet is like about here inside. It looks like your bladder is injured by the bullet. Some fluid in your belly that I'm not sure about. So I'm going to have to open you up and take a look.
Open up my belly?
Yes. So we're taking you up to the operating room now.
It's so hard not knowing. I can't stop shaking.
You can never predict because you never know what you'll find. We shall see. We shall see.
Driver 2, please. Arresting driver 2.
We have two elderly patients coming in after a fall. I think they're husband and wife.
74-year-old male who was walking into his home. He has what looks to be like a depressed entryway into his basement. His wife began to fall into the pit. He went to grab her and he went with her. He landed predominantly on his left hip.
Can you do an IV in your right arm, okay? He's got a scrape over his left shoulder. He's got a scrape here.
I got one at the end.
Yeah, you got one here too.
Bleeding like a stuck pig.
Can you feel me touching your foot?
Yeah.
How about here?
Yep.
Can you wiggle your toes? Perfect. That's probably broken. All right. This leg's about an inch shorter than the other one. So his hip's either fractured or dislocated, and given the fall, it's probably broken. We'll get some x-rays and see. The way your leg looks from that one side, I'm worried about your hip there.
You know what's hip.
So you're gonna go in for a CAT scan, okay? Yeah. So we're gonna take a look at his wife. Now listen, touch your chin to your chest. He was going down after his wife. She fell, somehow caused him to fall. They both fell sort of separately, at least not landing on one another.
My husband, he says he's going to report me for elderly abuse. And I keep telling him he doesn't know the half of it yet.
I was going to say,
he's really going to be
you've been living with that abuse for 40 years.
I get the feeling like he maybe went to grab me and lost his balance. Is he here?
Yeah, he's here, right here. You want to say hi to him?
Yeah.
Okay. I'm going to bring him closer to you, okay? Just bring
Is that him?
Yeah. Hi.
What the hell is she in? I'm saying too.
How are you?
All right, thanks.
You all right?
Yeah.
Are you?
How are you?
No, I'm good.
The good news is that it doesn't look like he has a head injury or an injury to his spine. The bad news is that it does look like he broke his hip. Fortunately, I think his wife has gotten through this relatively unscathed, so she'll probably be fine to go home. But he'll need surgery to repair his hip fracture.
So I gotta go now.
Okay.
I'll see you in a bit. I love you.
They seem like a sweet old couple. I think they do everything together, which includes now getting injured.
Be good.
Yeah.
Tip your chin up to the ceiling and take some big, big breaths, okay?
You have a young kid who got shot in his pelvis. You have to determine what injuries are inside caused by the bullet. Depending what you find, that will determine what we do. Okay, I'm ready to go. Incision.
I just want to bring him back home. That's it.
Beautiful. So this is a bullet track that went in, that's where it came out. There's a graze wound there. When he was standing up, he was running. That means that here would be a more likely place. All right. So far, a bunch of holes in a small bowel made by the bullet bouncing around inside of him.
Okay.
Wait.
Hold up.
Right there. You feel the bullet?
Yeah. Yeah, there's a bullet's in his intestine.
And then we'll take the bullet out and close that area where the bullet is.
There it is. That's gotta go to the cops. Look, wash mat, close.
2 stitches now, please. Don't try this at home. He has youth on his side.
That's true. He was only 19, right? He's gonna do great.
You know, I know it's going to take time for him to recover, and I'm going to be here with him every step of the way.
Okay, what do you got?
This is a copy of all your information and medications.
Don't lift anything heavier than 25 pounds for 6 months.
Our patient with the torn aorta is doing great. He's up walking, getting around, and in fact, he's going home today.
Well, he's coming home with like half a dozen medications.
Okay, if I have to hold him down and we'll funnel him down his throat, he's taking them.
You should maintain a low-fat diet.
Yes, ma'am. Low sodium bacon.
The doctor came right out and told us that 60% of people that this happens to don't make it to the hospital.
You ready?
I'm still here. They ain't killed me yet.
Nobody's forgotten anything?
I don't think so.
Hey.
I've been praying every day. I'm not ready for him to be gone yet. We got a lot of time to spend together yet before we're done.
This woman had a stroke 5 days ago, and it's amazing to see her up and walking and talking with her family.
What's been really amazing is the fact that less than 48 hours ago, she couldn't speak, she couldn't walk, she wasn't anybody I knew.
Everything that I had just went away. It just passed away, and we thought, it's gone. Everything we know, it's gone.
And I was scared to death. And, you know, the recovery from that period to now has just been amazing.
Do you remember your birthday?
10/20/1942.
Oh.
That's good. That's good.
You cheated.
Okay, cheater.
Goodbye, Mass General. Thank you.
Now you go to the front seat or the back seat?
I'll probably be in the front.
Okay.
I love my job. I tell my kids and my family that all the time. To be able to see people not only now, but a month from now, or 6 months from now, or a year from now when they're walking and they've recovered and they're alive.
I can't believe I'm coming home, so it's very wonderful.
Oh, wow.
They're breaking us out. They're sending us home. We're so lucky.
It's a lot better than when we came in.
One moment we were dying, and the next moment we were like, I thought my life was over, and somebody saved my life. Thank you.
Bachelor in Paradise continues tomorrow, followed by After Paradise on ABC.